Hi, my name's Bo. I'm from Sydney Advanced Physiotherapy and I'm here to talk to you today about constipation. Generally there are two types of constipation, one where you are trying to pass a hard dry stool. The second type is where you have a normal type of stool, but because the muscles around your back passage are so tight, you find it hard to get it through. Either types of constipation will generally lead to you needing to strain to really get the stools to empty out. So what can constipation do? It can give you symptoms of bloating, incomplete emptying, cramping, can give you hemorrhoids, fecal impaction where your stools are just really pushed hard together. It can even give you diarrhea. And for those who have chronic constipation, it can give you rectal or vaginal prolapse or even stress incontinence. So what are the causes? Generally, the causes are not having enough fluid, not having enough fibre, your bowels itself being quite slow to get it through the colon. It may be your diet. So sometimes for people, a diet high in carbohydrates and proteins can be constipating. Some medications can constipate you. Common ones are iron tablets and also pain medications like codeine. The other cause of constipation may be, I've mentioned before, is the inability to relax the muscles around the back passage. Prolapse is another cause of why someone may need to really strain to empty their bowels. What can you do about your constipation? Proper positioning on the toilet. So Claire on our Facebook page has done a really good video on how to position yourself to empty your bowels a bit more effectively. If you do have the urge to have a bowel motion, try not to delay it, because the longer you delay your bowel motion, the harder the bowel motion will be. You need to ensure that you're drinking enough fluid and having enough fibre, and you're moving around. So your exercise, just the fact that you're moving, will help to move the bowel motions along as well. Look at your diet. So if you know there are certain foods that may clog you up a little bit more, maybe just have those foods more in moderation or avoid them altogether. Look at your medication as well. So some medications, there may be alternatives. If you do feel that they are constipating you, you can have a chat with your GP or your pharmacist about it. Certain medications like laxative and enemas can help with the constipation to try and just unclog you so the bowels learn how to function properly. But all in all, medication should always be consulted. You should always consult your doctor if you are making any changes. What can physiotherapy do? Physiotherapy can teach you how to relax your muscles around your back passage. A lot of us don't know that we're actually really tightening our back passage, even though we should be relaxing them. And sometimes for some people, pelvic floor release work of the muscles can help the muscles relax. So if you're not emptying due to a prolapse as well, you may need to reduce the prolapse before you try and empty your bowels, as this can form an obstruction or a kink in the pipe for your stools to pass through. And so we can give you advice about what equipment or things that you can do to unkink or reduce the prolapse. So I hope this video has helped somewhat, and if you think this is something to share with your friends, please do so, and if you have any questions or comments, please leave it on our Facebook page, and looking forward to seeing you at Sydney Advanced Physiotherapy.